Well, in the previous class, we talked about doing a psychosocial assessment. In this class, we talked about promoting psychosocial wellness in the older adult. And that's an important function, as you'll see as we develop a little more of what's taking place in the brain of the older adult. Now, there's age-related changes that can really affect cognition levels there. And that's a great deal of individual variability in cognitive levels. There's multiple interacting factors that influence cognitive aging, and each older adult really experiences a mixture of decline, preservation, and improvement in cognitive abilities. So lots of age-related changes that can occur of it, and certainly there's a fair number of theories that take place regarding intelligence, memory, and psychological developments, and we'll talk about a couple of those. The central nervous system in the older adult, we have a real benefit now because in days gone by, if somebody was suspected of having Alzheimer's dementia, it required autopsy. And autopsy does remain the official confirming method of diagnosing Alzheimer's. However, we have imaging studies that are able to really give a better picture of what's going on in the brain before that point. And it shows diminished brain volume and loss of white matter when there's changes associated with declines in some aspects of cognitive function, whether it be Alzheimer's dementia or some other cause. You see decreased cerebral blood flow and cortical volume loss, especially in the frontal lobes of the brain. The brain actually gets reduced in weight, and you see enlarged ventricles and all the other changes that take place that you see listed there. So we're actually able to get a nice looking 3D image of the brain with the new technology that's become available. Some terms to be familiar with include neuroplasticity, the brain and neural circuits' ability to change and develop through the adult lifespan. As things happen, the brain does have the ability to sort of flex back and forth to meet the needs that are there to a point there. And recent studies indicate the function of neuroplasticity is occurring at a much different rate than originally thought. The concept of cognitive reserve refers to the capacity to continue to function at an adequate cognitive level despite whatever age-related or pathological processes are affecting the neural structures. What we're finding, though, is that having stimulation makes a big difference there. That's why you're seeing a greater interest in older adults taking education classes or seeking out other intellectual pursuits, because it actually helps protect an older adult from experiencing cognitive decline. Study after study has shown that. Then the scaffolding theory of aging and cognition is the development or use of complementary and alternative neural circuits to achieve a cognitive goal. Think of it as a rerouting, or if you want to put it to a road construction, there's always an alternate route when part of the road is under construction that people are sent on to still get to where they need to go. That's what the scaffolding theory of aging and cognition works with. In terms of fluid intelligence, that's the ongoing process of information processing to draw conclusions and to make decisions. And then there's crystallized intelligence, the acquired education, information, learning, experience, and stuff that's associated with wisdom, judgment, and life experiences. And all of these have a true effect on the level of cognition that an older adult person has. Two types of memory to keep in mind, and this will be an important one. Remember, you have primary and secondary memory. And if you want to think of memory, it can be really conceptualized as computer-like information processing. So you look at primary memory, it's the short duration, really doesn't have a whole lot of room for that, but it becomes this sort of a holding tank of what you're seeing now before it gets committed to secondary memory. And then secondary memory is longer duration, becomes important for information retrieval and for long-term storage of information. Think about how the dementia patient can sometimes remember things very well from the past, but have very much difficulty remembering what it is they're trying to say at the moment. And that'll help explain the difference between the two forms of memory. When we're looking at adult psychological development, I'll ask you to think decisional in the process. Something that I brought up in a previous class there, but the decision-making skills is what is decisional. And affective information is information that's considered interesting and motivating, and people rely on affective information when they're making decisions and judgment. However, in the older adult, in some cases, it may require more time to make those decisions, especially if there's new or complex information. Sometimes it takes just a little bit longer to get processed. So the nurse needs to recognize that you need to be patient, and sometimes they need to teach that to the older adult's caregiver, spouse or whatever, who may have been used to somebody who was making snap decisions now having a little slower time making those types of decisions. Lots of different risk factors we've talked about already that affect cognitive wellness. Personal, social, and attitudinal influence. The biggie there is ageism. Negatively approached expectations that can affect cognitive function. And then health factors like chronic conditions, medication effects like prescription and over-the-counter meds that can affect memory and cognitive functions. And then environmental factors like occupational, environmental exposure, sociocultural influences. All those things that we've talked about in previous classes are all risk factors that can affect cognitive wellness. The nurse needs to work about teaching about memory and cognition, both at an individual level and perhaps in community settings and such with groups of people, ways to improve concentration and attention. Sometimes doing some things like crossword puzzles works the extra areas of the brain to improve cognitive wellness. Encouraging people to take part in mentally stimulating activities. Tons of free classes actually are available, and low-cost classes at available universities and community colleges certainly have that option for people to have mentally stimulating activities. And then adapting health education materials to fit the need. What does the older adult person need to know specifically? Older adult psychosocial changes are challenging because you're looking at compromised health and function, and they're probably the most challenging and demanding in terms of coping energy because these challenges are associated with that health and function, and also by role changes and by relationship changes and living environment changes. So nurses can promote psychosocial wellness through the development of effective coping strategies. Lots of changes that can affect psychosocial function. Life events that take place, anywhere from retirement to relocation, could be anywhere from their longstanding home to a condominium, to a assisted living facility, maybe to a long-term care facility. And you can see transfer trauma and transplantation shock. Someone who needs to be involved in decision-making maybe has difficulty doing it in those types of process. So that may warrant having a psychosocial assessment done to make sure it's not something that's more deep-seated going on. And then chronic illness and functional impairments and decisions about driving, changes in life events like widowhood. Incidentally, women become more widowed more often than men. The death of friends and family. And then, of course, defending against the ageist attitudes. You're getting old, you can't expect to do that anymore. Why not? Unless they physically are unable to. So there's lots of theories that are designed to help answer questions about stress and coping in older adults, and those need to be weighed in there. We're going to cover a couple of them here in just a moment. Stress is the sum of all effects of factors that act on the body. You have stress in nursing school. We all have stress in life, sometimes more stress than others there. And stressors can be good, they can be bad, but stressors are basically normal activities, but they also can be disease states, and they can be pleasant stressors or unpleasant stressors. General adaptation syndrome is one of the standouts for the theories that occur there. Developed some time ago, the 3 stages include alarm, resistance, and exhaustion. And At the alarm reaction stage, the brain's hypothalamus gets a distress signal, which then makes the hypothalamus release glucocorticoids, which trigger the release of adrenaline and cortisol, and that gives the person a boost of energy. See the graphic going up toward the last half of the alarm stage on the visual here. And their heart rate increases, their blood pressure increases, and because of the release of glucocorticoids, their blood sugar releases. And this is what you might have heard before the term a fight or flight response from the sympathetic branch of the autonomic nervous system, which causes alarm to the person. The next stage is the resistance stage, the second stage of the GAS, and during the stage the body has increased capacity to respond to the stress. It builds up the energy, tries to take care of things, and if the stressor persists, the body can actually become exhausted, entering the exhaustion stage, the final stage, where the body has depleted its energy resources by continually trying but failing to recover from that initial alarm reaction stage there. And that's where some important changes can happen in the human body. Chronic stress disrupts nearly every system in your body. It can suppress your immune system, upset your digestive and reproductive systems, increase the risk of heart attack and stroke, and actually can end up speeding up the aging process as well. Then there's the Social Adjustment Rating Scale, done back in 1967, I believe it was, and it identified life events and how much of a significance it has on people, going through multitudes of people and assessing this. And you see some of the mean values that you see there make the difference. And I just did the first few there that you could see there. But according to the American Association of Retired Persons, AARP, 90% of Americans aged 75 and older have at least one chronic medical condition, and 20% have 5 or more chronic illnesses, multimorbidities. And the cost for caring for people with 5 or more chronic illnesses is roughly 17 times higher than someone who doesn't have any kind of a chronic illness. This is where care coordination, a factor that I need you to really put focus on as you're preparing for things. Care coordination was identified by the American Nurses Association as a core professional standard and competency for all RNs. And it's really critical to improving outcomes across all populations, but especially in our older adult population we are focused on. Care coordination is essential to achieving what's called the triple aim of healthcare reform as identified by the Institute for Healthcare Improvement. Triple aim includes improved patient experience of care quality and satisfaction, improved population health, and reduced per capita healthcare cost. It sort of makes sense when you think about that. It's going to take care of the person and the whole population and preserve our healthcare dollars so that as the aging population increases, there's more money available to help fund the care that's needed. Psychosocial factors that influence the function in older adults, really kind of a key thing here that we look at how those have an influence and what relevance it has for nursing. And we're going to be talking about those in the next section.